Welcome to the Medi-Cal Pediatric Integration webinar. Let's take a look at our agenda for today. Today, we will discuss the pediatric integration. We will discuss what happened as of January 31st and what occurred on April 25th, as well as distinguish the difference between New Start and continuation of therapy claims. Additionally, we will discuss CCS panel provider authority policy. Then, we will review some helpful contacts and resources, such as the CDL, covered products list, and approved NDC list. Additionally, we will discuss common reject codes and how to resolve them, along with applicable case studies. Now let's dive into pediatric integration. Medi-Cal Pediatric Integration aims to integrate the pediatric population into the Medi-Cal Utilization Management Program by implementing pediatric appropriate policies and operational workflow. The foundation of the implementation of this plan is focused on stakeholder feedback and preparedness, performance monitoring, and nimble adjustments. This purpose aligns us with our objectives to reduce disruption as well as ensure safe and timely delivery of pharmacy benefits. Let's take a deeper look into pediatric integration. Similar to adult reinstatement, Medi-Cal Rx took a multi-step approach to pediatric integration that included a transition period to allow continuation of therapy claims to not require a PA until April 25th. As of January 31st, Medi-Cal Rx implemented claim utilization management edits and prior authorization requirements for members 21 years of age and younger for all drugs and products, except Reject Code 75 prior authorization required for continuation of therapy claims. Pharmacy providers and prescribers may proactively submit PA requests up to 100 days in advance of New Start therapy or PA expiration for members 1 year of age and older. Medi-Cal Rx also implemented the CCS panel authority policy for CCS panel providers who are physicians or certified nurse practitioners and enrolled in Medi-Cal. As of April 25th, continuation of therapy claims for members 21 years of age and younger are subject to Reject Code 75. This concluded reinstatement efforts for all pharmacy benefits under Medi-Cal Rx. All edits and PA requirements are now turned on, and anything outside of published policy on the Medi-Cal Rx website will require prior authorization demonstrating medical necessity. Please note, pharmacy providers and prescribers should proactively submit PA requests up to 100 days in advance of PA expiration for members 1 year of age and older. Now, let's talk about New Start versus continuation of therapy claims. While there are other aspects to pediatric integration, this slide will focus exclusively on the differences between New Start therapy claims and continuation of therapy claims. We aim to provide a clear explanation of these differences and what took effect starting January 31st and April 25th for members 21 years of age and younger. Let's start with New Start therapy claims. New starts are defined as new to therapy or an absence of paid claims in the past 15 months prior to the current claim date of service. As of January 31st, New Start claims submitted for members 21 years of age and younger are subject to all Medi-Cal Rx claim edits and PA requirements, including Reject Code 75 prior authorization required. As of April 25th, there will be no changes to New Start claims. Now, moving on to continuation of therapy claims. Continuation of therapy claims are defined as claims submitted for an NDC of the same drug or product found in previous paid claims within 15 months prior to the current claim's date of service. As of January 31st, continuation of therapy claims are subject to all claim edits and PA requirements for all drugs and products except Reject Code 75 prior authorization required. As of April 25th, continuation of therapy claims submitted for members 21 years of age and younger are subject to Reject Code 75 prior authorization required. We will now switch gears and discuss CCS panel authority policy. CCS panel providers who are licensed to prescribe medications and are Medi-Cal enrolled will be granted prescribing authority for all pediatric members treated by these panel providers. As of January 31st, Medi-Cal Rx also implemented the CCS panel authority policy, in which CCS panel providers who are physicians or certified nurse practitioners have authority to prescribe for members 20 years of age and younger without submitting a PA for Medi-Cal Rx covered drugs and products, with some exceptions. CCS panel authority policy is not impacted by the implementation of Reject Code 75 for continuation of therapy claims. CCS panel authority policy covers the PA requirement when the following conditions are met. The member is 20 years of age or younger. The prescription is written by the member's physician or certified nurse practitioner who has CCS panel authority, or the claim denies with one of the following reject codes. Reject Code 75, prior authorization required, some exceptions do apply, or Reject Code 83, duplicate paid captured claim when submitting for enteral nutrition products. Please note, all other Medi-Cal Rx claim edits will apply and may require PA request submission. The CCS panel authority policy applies to medications and supplies on the Medi-Cal Rx CDL, with some exceptions. Pharmacy providers and prescribers are encouraged to utilize the Medi-Cal Rx approved NDC list to identify what drugs and products are excluded from CCS panel authority and what drugs and products require a PA. For drugs and products that do not require a PA, refer to the CDL and covered products list for other requirements such as Code 1 restrictions. Let's move on to our next section to discuss these lists. The Medi-Cal Rx contract drugs list, covered products list, and approved NDC list are available to assist all pharmacy providers and prescribers, including prescribers with CCS panel authority. Let's begin with the covered products list. Refer to the CDLs and covered products lists available on the Medi-Cal Rx provider portal under Forms and Information, which are updated monthly, for information regarding drugs and products that are eligible for coverage and reimbursement under Medi-Cal Rx. These lists, along with the approved NDC list, communicate coverage restrictions. Prescribers are encouraged to review these lists for consideration of prescribing contracted products that do not require a PA when appropriate. Pharmacy providers are encouraged to review the approved NDC list and list of covered products to identify approved NDCs for dispensing. The CDL is searchable by generic name and is alphabetized by therapeutic class. This list communicates Code 1 restrictions that apply to Medi-Cal Rx contracted drugs and products. Drugs not found on the CDL require a PA. Drugs and products found on the CDL may also be subject to type Code 1 restrictions, such as those listed on the slide. Additionally, claims may be subject to other policy restrictions not listed on the CDL that will be evident upon denial and are of sound clinical practices and FDA-approved dosing. Refer to the Medi-Cal Rx CDL and approved NDC list navigation video for additional information regarding the CDL and covered products list navigation. Pharmacy providers and prescribers can proactively review the Medi-Cal Rx approved NDC list for information regarding drugs and products eligible for coverage under Medi-Cal Rx as a pharmacy benefit. The approved Medi-Cal Rx NDC list can be found on the Medi-Cal Rx provider portal and is viewable as an Excel file. This list can be filtered and sorted by generic and brand name and is searchable by NDC. The NDC list will also indicate PA requirements by NDC. Additionally, the Medi-Cal Rx approved NDC list provides details around NDCs impacted by specific policies, such as prior authorization requirements, extended duration PA policy, cost ceiling limits, and etc. Providers and prescribers are encouraged to review the Medi-Cal Rx CDL and approved NDC list navigation video for additional guidance. Now, let's discuss how the approved NDC list can be utilized for providers with CCS panel authority. The Medi-Cal Rx approved NDC list also includes a detailed list of drugs and products included and excluded from the CCS panel authority policy by NDC, which is updated monthly. CCS panel providers are encouraged to review the Medi-Cal Rx approved NDC list to determine which drugs or products are excluded from CCS panel authority policy and will require submission of a PA request. Now, let's look at how to resolve some of these common rejects. Let's go over some of the most common reject codes that providers may encounter when submitting claims. Common rejects that may apply when submitting claims to Medi-Cal Rx include, but are not limited to, those seen here on the screen. For a more detailed list of claim requirements, refer to the Medi-Cal Rx Provider Manual and the claim submission reminders linked here. Next, let's go into more detail on these reject codes. If claims return with reject code 75, providers can review the CDL and determine if alternate therapy is appropriate. If covered alternate therapy is not appropriate, providers can submit a PA request. As discussed earlier, prescriptions submitted by CCS panel providers will be exempt from reject code 75 unless identified as an excluded medication or product. Other edits, including quantity limits, will apply. Please note, as of January 31st, Reject Code 75 applies to all New Start claims, and as of April 25th, Reject Code 75 applies for continuation of therapy claims. Medi-Cal Rx policies, such as CCS Panel Authority and Extended Duration PA, may reduce the need for PA submission. For information on if these policies will apply to drugs or products, refer to the approved NDC list. As of January 31st, Reject Code 76 has been implemented for members 21 years of age and younger. Reject Code 76 messaging informs providers of quantity limitations for maximum days supply and quantity days supply. To help resolve Reject 76, plan limitation exceeded, providers are encouraged to review Code 1 restrictions and quantity limit requirements on the CDL, specific manufacturer and prescribing information, and the Medi-Cal Rx Provider Manual for quantity limits for medical supplies. If resubmission of the claim to meet quantity limits is not appropriate, a PA is required for coverage consideration. Point-of-sale overrides are not available. When applicable, submit a PA request via one of the 5 approved Medi-Cal Rx PA submission methods. For more detailed information, refer to the How to Resolve Reject Code 76 alert. As of January 31st, Reject Code 78 has been implemented for members 21 years of age and younger. If Reject Code 78 cost exceeds maximum is received, providers should confirm the claim is submitted accurately and validate the prescription quantity and days supply is correct. Consider prescribing a less costly therapy if clinically appropriate. If a change in therapy is not appropriate, submit a PA request via one of the approved Medi-Cal Rx PA request submission methods. Please note, this policy will apply when the pharmacy claims exceeds the dollar claim amount threshold and will reject 78 with supplemental messaging that you will see on the screen. For more detailed information on how to resolve Reject Code 78, refer to the How to Resolve Claim Reject Code 78 Cost Exceeds Maximum alert. As of January 31st, Reject Code 80 has been implemented for members 21 years of age and younger. If the Code 1 diagnosis requirement is not met, claims submitted to Medi-Cal Rx will deny with Reject Code 80 with supplemental messaging. Prescription documentation requirements apply to Code 1 diagnosis restricted drugs. Pharmacy providers and prescribers must document the treatment diagnosis and keep that information readily available for auditing purposes. For more detailed information on how to resolve Reject 80, refer to the How to Address Reject 80 alert. As of January 31st, Reject Code 83 has been implemented for members 21 years of age and younger, with exceptions. Reject Code 83, duplicate paid captured claim, occurs when more than one claim is submitted for the same member, drug, and date of service, in which the first claim paid and the second claim is captured as a duplicate transaction. For more detailed steps on how to resolve Reject Code 83, review the NCPDP Reject Code 83 duplicate paid claim captured. Please note, as mentioned earlier, CCS Panel Authority Policy covers the PA requirement for Reject Code 83 when submitted for enteral nutrition products. As of January 31st, Reject Code 606 has been implemented for members 21 years of age and younger. Reject Code 606, Brand Drug Specific Labeler Code Required, reinstates Labeler Code requirements on brand multi-source drugs where the brand name is less costly than the therapeutically equivalent generic alternatives. Code 1 labeler restrictions can be found in the CDL as well as in the supplemental message returned upon claim adjudication. If resubmission of the claim to meet the labeler restriction is not appropriate, a PA request is required for coverage consideration. Point of sale overrides are not available. Reject Code 606 requires submission and approval of a PA to receive a paid claim with Medi-Cal RX. Next, let's discuss how to submit PAs to Medi-Cal RX. PA requests can be submitted via the approved Medi-Cal RX submission methods: Cover My Meds, Medi-Cal RX Secured Provider Portal, NCPDP P4 Transaction, fax, and US mail. As discussed previously, pharmacy providers and prescribers can submit PA requests in advance for members 1 year of age and older. Due to potential rapid changes in an infant's health status, PA requests for children younger than 1 year of age should be submitted with the prescription. Members with an approved PA request will remain active through its approved length of authorization. Medi-Cal RX will ensure PA requests are reviewed and the PA submitter receives notification of determination of that PA request within 24 hours. Determination responses include approval, deferral, approval with modifications, informational, and/or denial as directed by DHCS. For more detailed information, refer to the Medi-Cal RX Provider Manual. Next, let's take a look at some case studies and how some of these common reject codes interact with CCS Panel Authority and Pediatric Integration. In this case study, we have a CCS member who is 9 years old. This member is about to begin a new start therapy. Our member's doctor, Dr. Smith, is not a CCS panel provider, therefore, CCS panel authority is not applicable. When prescribing, Dr. Smith reviews the CDL and sees the medication has Code 1 restrictions and proceeds to review the diagnosis crosswalk to provide a clinically appropriate diagnosis code with the prescription. When ABC Pharmacy receives the prescription, they submit a claim to Medi-Cal RX and receive Reject Code 80 for diagnosis required. Since Dr. Smith already provided the diagnosis with the prescription, they input the applicable diagnosis code and resubmit the claim to receive a paid claim. Let's move on to our next case. In this case study, we have a CCS member who is 16 years old receiving a continuation of therapy medication that is an excluded product from the CCS Panel Authority policy and would traditionally reject with Reject Code 75. Our prescriber, Dr. Smith, is a CCS panel provider, but CCS panel authority does not apply in this scenario because the medication is excluded from CCS panel authority. Dr. Smith has reviewed the CDL and identified that this drug is not listed on the Medi-Cal RX CDL and there is no appropriate alternative therapy. Therefore, this drug would require a PA. ABC Pharmacy submits the claim to Medi-Cal RX and receives Reject Code 75, and a PA will be required. In this scenario, a PA is required because even though the provider is CCS paneled, the medication is a CCS paneled excluded product. As a reminder, to prevent potential gaps in care, Providers and prescribers can submit a PA in advance of PA expiration for members 1 year of age and older. In this case study, we have a CCS member who is 20 years old and is receiving a prescription for a continuation of therapy for an enteral nutrition product. Dr. Smith is not a CCS panel provider, and therefore CCS panel authority policy is not applicable. ABC Pharmacy submits the claim for two different flavors of the enteral nutrition product and receives reject code 83 for a duplicate claim and reject code 75 PA required. A PA request can be submitted to Medi-Cal RX, establishing medical necessity to resolve both reject codes. The pharmacy may also call the Medi-Cal RX Customer Service Center to resolve reject code 83 for the two flavors and submit a PA request to resolve reject code 75. In this scenario, Dr. Smith did not have CCS panel authority. As we discussed earlier, CCS panel authority would apply to both reject code 75 and reject code 83 in this situation, and ABC Pharmacy would not have received a reject had Dr. Smith had panel authority. In this study, we have a non-CCS member who is 2 years old and receiving a continuation of therapy for a drug that requires a PA and would traditionally return with reject code 75. Our member's prescriber, Dr. Smith, is CCS paneled, and CCS panel authority policy is applicable. Even though our member is not a CCS member, Dr. Smith's panel authority will still apply. ABC Pharmacy submits the claim and receives a paid claim. In this study, we have a non-CCS member who is 21 years old and starting a new medication that requires a PA and will reject with reject code 75. Prescriber, Dr. Smith, is a CCS panel provider, but CCS panel authority is not applicable due to the member's age. Even though Dr. Smith has panel authority, which allows the claim to not reject with reject code 75, it is not applicable to this claim. As we discussed earlier, CCS panel authority only applies to members 20 years of age and younger, and since our member is 21, CCS panel authority will not apply. ABC Pharmacy submits the claim to Medi-Cal RX and receives reject code 75 and will need to submit a PA request. In this study, we want to look at a claim for a newborn member. We will first discuss PA requirements, then discuss how to submit claims for newborns to ensure they are processed properly. This newborn member is receiving a new start therapy for a medication that requires a PA and will traditionally return with reject code 75. This member's prescriber, Dr. Smith, is a CCS panel provider with CCS panel authority. ABC Pharmacy will submit the claim to Medi-Cal RX and receives a paid claim because Dr. Smith's CCS panel authority allows claims to pay without returning reject code 75. Now, for the newborn part of submitting this claim. For Medi-Cal and CCS eligible members, newborn members will be covered under their mother's Medi-Cal RX ID for the first month of birth to the end of the following month, up to 60 days. Claims for newborns will be identified via the relationship code and PA type code. A relationship code value of 3 for dependent and a PA type code value of 8 will identify the member as a newborn on the claim. If the pharmacy appropriately identifies the claim as a newborn, the CCS panel provider authority policy will apply and the claim will be processed with an appropriate age. If the claim is not appropriately identified as a newborn, the claim will be processed using the mother's age and CCS panel authority will not apply. Before we conclude our presentation, we want to provide you with important contacts and resources. On this slide, we have provided a list of available Medi-Cal RX Pediatric Integration resources. These resources can also be found on the Medi-Cal RX provider portal on the Education and Outreach page by selecting the Pediatric Integration tab on the left. Here are available Medi-Cal RX resources including PA resources, CDL, and enteral nutrition resources. Allow these resources to come to you by signing up for the Medi-Cal RX subscription service to receive alerts directly to your inbox. Here, we have included helpful links to efficiently navigate through Medi-Cal RX resources. But the most important message we want you to take away from today is that the Medi-Cal RX team is here for you. We encourage you to review our website resources. Schedule a one-on-one office hour via Microsoft Teams meeting by emailing ENO at medicalrxeducationoutreach@primetherapeutics.com. Also, our customer service center is available 24 hours a day, 7 days a week, 365 days a year to provide around-the-clock support. Additionally, you can email the Education and Outreach team at medicalrxeducationoutreach@primetherapeutics.com. Lastly, we encourage you to sign up for our subscription service, which will provide emails to your inbox directly regarding Medi-Cal RX updates. We also wanted to include some available CCS resources for your reference. And that concludes our webinar. Thank you.